breakthrough in treatments for chronic disease, chronic pain patterns, chronic nerve problems, hormone imbalances, literally just about everything. I've given some really neat gifts to be able to bring healing on patients that are out of hope, out of time, and out of money. Now the purpose is to expand our reach, and we want to reach, treat, and heal the world. Hi, this is Dr. Jason West, and I'm so excited to share with you a breakthrough in treatments for chronic disease, chronic pain patterns, chronic nerve problems, hormone imbalances, literally just about everything. And the therapy I wanted you to be aware of is called neural therapy. Now, how I describe neural therapy to patients in the office is it's kind of like a nerve memory or nerve dysfunction reboot system. Your nervous system has an amazing memory, and we never talk about this in the traditional medicine, and in most alternative medicine circles we never talk about nerve memory. Let me give you an example. If you walk into your home and your spouse or your mom or your children are making your favorite thing to eat, and you walk in and you're like, wow, that smells so good, and then about 45 seconds later your body doesn't recognize the stimuli anymore, and so what happens is you don't have that same smell, and then you forget about something. You go out, get something in the car, you take your garbage out, you take your dog on a walk, you come back into your home. Wow, that smells so good. What's happening is that stimuli is coming in and your body is saying, hey, this is a new stimuli. Now, another example of how your body can get used to things or how it can categorize things differently is through something called phantom limb syndrome. Now, what is phantom limb syndrome? What happens, I have a lot of ranchers and rodeo guys that come into the office, and one of them will come in and he'll have a rope caught around the finger, and the horse or the cow will take off and he'll pull their finger off and they'll say, Dr. West, my finger is killing me. Or sometimes it'll happen in diabetics or an industrial accident where they'll have some type of accidental amputation and they'll say, my foot's killing me, even though their foot isn't there. And the nerve is telling the brain that there's still the stimuli or there's still this pain pattern. Now, if your body was a computer and you called tech support and you said, my body isn't working right or my computer isn't working right, tech support would say, well, turn everything off and turn it back on. You can reboot the system. What that does is it helps the operating system to work better, and it gets rid of some lagging programs and some memory problems inside the computer. And I jokingly tease people, look, I can't really kill you and bring you back to life, but there is a way to reboot the nerves that control pain patterns and control organ function, and that's what neural therapy is. Now, neural therapy was pioneered in the 1920s and 1930s by a Dr. Huneke, and it was written about in a German textbook called the Manual of Neural Therapy, and it's this amazing Bible that we follow in the office. Matter of fact, my book is falling apart. I use it so much because I think it's helped me be a lot better doctor. Now, what neural therapy is treatment of the nervous system and specifically addressing those nerve memory problems associated with chronic disease patterns. So if you've had a rash or you've had a surgery or you've had some type of irritation to the outside armor of your body or the skin, it can set up what's called an interference field. And this is one of the reasons why I think scar therapy is so important. If you have scars anywhere in your body, it's really important for those to get treated. And I have had some amazing patient outcomes just treating scars. Let me give you an example. I had one patient that had come into the office that had 6 lumbar back surgeries for chronic low back pain, and none of them had helped. She had tried physical therapy, she had tried acupuncture, she had tried chiropractic therapy, she had tried being active, and she was just miserable pain. And we had done everything that we could think of in the hospice, and one day out of desperation I said to her, now tell me about when your pain started. And she said, well, it started after I got a lipoma removed. A lipoma is basically a benign fatty accumulation. They did a little surgical incision on 2 spots on her back. And I said, where does it hurt? She pointed to those scars. We treated the scars and all of her pain patterns went away. It was an amazing experience that scars create interference fields and any of those chronic areas where you're having disease, and it can set up a nerve memory, and then your body accepts that for being normal. And if you reset that with neural therapy, you can get some amazing outcomes. Now, here's what you do with a neural therapy. Take a real small syringe, a little tiny dental needle, and you inject either the scar areas or the areas above the organ that's not functioning right. So you can do this for kidney problems, you can do this for heart problems, you can do this for chronic pain problems. It feels like little bee stings. It's an annoying treatment. And the medicine that you use is a glycolized ester of para-aminobenzoic acid, which is a huge mouthful. But really what it is this amazing medicine called Procaine. And what Procaine does in the right application is it makes your nerves that control the organs and the tissues open, which we call hyperpolarization, close, depolarization, and then normalize, what we call repolarization. So you can actually reset the nerves for headaches, for chronic regional pain syndrome, for sciatica, for carpal tunnel, for liver problems, for stomach problems. And we've got hundreds of patient testimonials where we use the application of neural therapy to help resolve chronic problems. Now, when you do that and you change lifestyle, you put good building blocks in the system, you get your body on a schedule, you get oxygen, you get enough water into your system, you can take healthcare conditions that didn't have any medical options, that were out of hope, we're out of time. Basically, the patient's at their wits' end, and you can get those patients to turn around. And those are most of the people that we see in the office. We just don't have any other medical options, or we've exhausted everything, or we're tired of the prescriptions, or we don't want to do surgery. And this is a wonderful therapy if you have any of those conditions. So neural therapy is a way to reset the nervous tissue. It's been doing about 100 years in Germany. It's just starting to come to America. More and more people are doing it. It's one of the neatest treatments that I've seen in my office. Hey, thanks for watching the video. If you'd like more information, education, or want to work with us, head over to bestmedicaloptions.com. And if you want to help to reach, teach, and heal the world, leave a comment, like, share it with someone that you love. It may seem like an impossible task, but those that are crazy enough to think that they can change the world are the ones who do.